Hey guys, Megan here. So I just wanted to give you guys a video walkthrough, so to speak, about our new formula cabinet that we've put together here. As most of you know, we had to do a revamping action plan for our formula that wasn't getting logged in or logged out appropriately, and we were at the verge of losing our formula altogether. So this is what I've come up with. I just wanted to show you guys. I figured this would be better than pulling you about one by one over here. I know some of you work at different offices and come here after hours, and just kind of go through step by step so you can see how I did this. Now this is towards the side door where the respiratory stuff is. I figured that made the most sense to kind of keep all that together with all of our to-go items for our patients. So you'll see here at the bottom we've got the Enfamil and the nipples put together if we need something for the office. Pedialyte packs, these are more so like the miscellaneous stuff here at the bottom. Those PediaSure starter kits, the bags, and then I've tried to group things by brand. So here in the middle you'll see all of our Similac stuff, and then going up to more specialty hypoallergenic specific things here at the top. And you'll notice all of these different folders. There's not really anything color specific, but what you will notice is I've written for these. So let's look at this Similac 360 Total Care. We have a bunch of those. A big kind of overwhelming piece of this was figuring out how to separate out the lot numbers for this. You know, a lot of us were worried about having to look underneath every single tub to match up lot numbers to document. Well, I figured this would be a great way for us to just know what lot goes with what. So you will see the same ones are grouped differently, and that's because they are grouped by the lot number. So on each of these folders here, I've got the name, the lot number, and then the expiration date. So that's why you'll see multiple groupings of the same formula. So what I'm thinking is you know, say we're coming to grab the Similac 360, it's going to make the most sense for us to first look at the expiration dates, right? Just to make sure we're not wasting any formula. 5/1/25, 5/1/25. I know it's a little tight in here. 5/1/25. So all three of these have the same expiration. So next, depending on which lot has the least amount, so you know, maybe we pick this one or this one to pull from because this has the most. That way we can kind of consolidate this so we're not getting like 6 groupings of lots with like only 3 or 4 tubs in there, if that makes sense. At the top you'll see like the Pure Amino. I've got 2 different groupings of that, but this one here is going to expire before the one on the back, or maybe that's the wrong way around. Yeah, wrong way around. So this one would expire first, so I would pull from that before I would pull from that. Okay, we've got a lot of handouts that we really don't use a lot with our bags, so make sure we're pulling all these handouts, especially these Similac handouts with free coupons for our patients. It also has information to set up like patient assistance programs if they're having issues affording. Here on the left side we've got just our contact cards taped up for all of our reps if you needed any additional information or assistance for your patients. And then here on the right, I've got your bags hung up. So you can just grab a bag, and then if you need any help trying to figure out what we need to do, if we need to switch something up for the patient, I've got some information here taped up for you guys to kind of reference to help you through that. So of course, the biggie with us, right, is that we have not been logging in and logging out this formula. So I have also gone through our formula logbook. You'll open it up and you're going to see our formulary list, which this is going to change a little bit, so don't pay a lot of attention to this. Of course, what is in here is what we have. I don't have any back stock. It's all here. And I'm going to be responsible, initially at least, for Kernersville for logging in everything. So if you guys are here, you get a big box shipped in. The reps come by, you just have them just drop it off here on the bottom. Of course, for site assessment purposes, we cannot have anything there on the bottom. But for me, just for, you know, the next few minutes, just until I can come grab it and log it in personally, just let me do that so there's less hands in the honey pot. But then we'll be coming here to do that. So you'll see here all these tabs that we've done. This first tab is blank logs. So you'll flip there. This first copy is just a copy of an audit log that I would do, so don't worry about that. But this is what the log sheets are going to look like under each tab. And so what we can do, this first one is just for the nipples that go with those ready-to-use bottles. So every time you use one of those, you would have to come in here and put, it says box number, but obviously for this it would be an item number. So one nipple, the date you used it, for what patient, date of birth, the lot, which I've written all the lots down, so you would just pull it to there. The expiration date is on each of these. So for the nipple, I've got it right there for you. And then whoever is signing that out. I understand this can be overwhelming at first, so if anything, you could just give me how many items you've pulled and a patient name and birthday. I can handle the rest for you guys. So let's flip to, let's see, we got the Pedialyte packets, starter kits, bags. Let's stick with the Similac 360. So we're going to go to that. So again, you notice there are multiple lots that I've got 1, 2, 3. So for each of the lots, I've got a separate page. I've got 360 with that lot number and how many. So 3 boxes, 12 total tubs. So we are gonna, where it says box, you're gonna put how many tubs of formula. So I grab these 2, I'm gonna put 2 on that logbook. But again, there's a page for that lot number. We're going to flip to the next page. There's a different lot number and a different lot number. So every time I have to log in a new formula, I'm going to have to start a whole new sheet, which is why I want you guys to just put the box right there in the bottom for me, and that would help us keep this all together. 2 things I need from you guys to do is, again, just when you pull your formula, put how many tubs you're grabbing, patient name, date of birth. I can handle the rest. The second part of that for the providers, are you listening? I know. One more thing for you to do, but it's a small thing. Oh, actually, let me show you. I printed out. So you guys are going to have to put in an Epic order for this. Or clinical folks, if you want to help your provider out and do that for them, if you see them getting some formula out, you can certainly do that. So in here, I've got our sample management process, kind of our policy and procedures. There's a little PowerPoint if you guys want to run through that. This is just kind of just random references and resources on how we do this process. This sheet's for you guys, though. This is going to go over how to put in that Epic order. So pretty much you will go to your after visit orders. I'm sorry, I cannot get that to zoom in. You'll go to your after visit orders, so it won't be a encounter while they're here with us. It'll be after visit, kind of like you're ordering medicine to send out to the pharmacy. I wish this would zoom in a little bit better for you guys. I'm so sorry. But right where you see class, it will say normal, print, historical, OTC. There is a drop-down option to pick sample right there. And that's where you will pick your sample. So you'll type in like Enfamil, you'll type in Similac, you'll type in Nutramigen, and that's where you will do the outpatient order and change that to sample. Now all this information will still pop up. What you can do is you can hit use free text, and it will take all of this nitty gritty away for you guys, so you can just free type in anything. From there it will do similarly to like your labs, given Tylenol. It'll pop up like a blue dot for the clinical folks to go in and fill in the lot number and the expiration date and the amount of tubs. And they do that just so they can do, you know, say we have some recalls, like we had a big one a few years ago. They can go in there through Epic and see which patients may have been affected by that recall and give them a call. So I know it seems like you're doing double charting, but I think once we get into the groove of things, it will not feel so overwhelming. So that is it, folks. Now for your other offices, Walkertown, Union Cross, Oak Ridge, just know when we come back for our initial office visit here in the next few weeks for our new office specific meetings, I'll be kind of going through your formula, seeing if you have anything set up. If not, then we'll talk through maybe me coming by at a certain point and doing something similar just to help you guys nail down a process, because again, the site assessment for next year will come around super quick, and we want to go ahead and get into the habit of our new process. And it'd be great to have something similar across the board, since we do float to different offices. Especially for here, we're going to use this a lot of after hours, and we have a lot more people coming through. So please be diligent to just, again, Epic order, and then logging in that formula logbook. If you have any needs, questions, concerns, or ideas on how to make this even better, please reach out to me and let me know. But again, this is going live right now. I've logged everything. So from here on out, let's make sure we're diligent in doing that. Thanks for all you guys do. Bye.